Good afternoon. I hope you can hear me. I'd like to inform you that we have been following our staff very carefully from both of these patients. And as of this morning, when we had our meeting, there were about 80 people who have been informed of the patients positive for COVID and those patients who have passed away. So our occupational health and wellness group are working on that information, and at this point, 80 people have been informed.
So they've been, so they had some sort of exposure to these cases then?
Many of them, the majority of them, would have been using protective gear or protective equipment, and certainly as soon as particularly this patient was presented in our ED. However, even those who are in direct contact or in the vicinity have been informed.
Thank you.
Okay, Erica, do you have a question, and would you like to direct it to whom you would like to talk to?
Yeah, please. I have a question for Dr. Gardner. The two cases out of Barrie that have now died, were they related? Like, were they brothers?
So we always have to be very careful about protecting privacy for patients. And so I'm going to decline to elaborate further on their relationship.
Do you have a follow-up question, Erica?
Yes, regarding, to Janice, the 80 people informed, are those all staff at RVH?
They would be employees, physicians, since we no longer have volunteers at our facility during this time. I believe that's restricted to employees and physicians.
Okay, thank you. Dawn, do you have a question?
I do, for Dr. Gardner. Not relating to these cases specifically, but if you're willing to comment, I know one of the things we've been hearing from other areas is the number of ventilators that are available to help people who are in critical conditions. I'm just wondering if you're able to comment on what the hospitals in the region are doing to prepare for a possible influx.
So I must acknowledge that I don't have specific information on that. We have been advising hospital CEOs for some time now, in the vicinity of a month or more, meeting with them by teleconference weekly about their preparations. Their concerns that they've raised to date have been related more to access to personal protective equipment and the need to facilitate testing of patients and the need to establish assessment centers in order to facilitate that. I have not heard them specifically cite the ventilator capacity, so I'm afraid I don't have information specific to that. I would ask if Janice Scott would have any information with regards to RVH and ICU capacity.
Oh, and just before you answer that, Janice, could I remind everyone to please mute their phones? There's some paper being moved around a little bit. It's a bit noisy. Thank you. There we go.
Hi. Oh, okay, Janice here. We, first of all, we're looking at expanding our capacity with respect to intensive care beds in general. And so we have a plan in place to double, in the short term, double our capacity of the intensive care unit. Of course, that's only effective if we have both the staff and the supplies available. So specifically with respect to the ventilators, it might have been me rustling papers, so I don't want to give you the wrong number. I know Suzanne Legui is on the phone as well. But we are, first of all, we have acquired additional ventilators that are coming into our building, we believe, next week. Just trying to find the right information. So can I come back to you on the exact number of ventilators we have? The more important message is that we are doing everything possible to increase the number of ventilators we have, as well as ensuring we have the staff and other supplies available if, in fact, an expanded intensive care unit became necessary.
Okay, thank you. Any more further questions?
No,
yes,
thank you.
I do.
And this is Erica?
Yeah, is that okay, or am I out of turn?
No, go ahead.
Okay.
Sorry, it's Janice again. I can now tell you that we have 36 ventilators at RVH currently, and we're working toward expanding that number as well.
Thank you. Okay, Erica?
Yeah, Dr. Gardner, you said the second patient has died and it's COVID-19 related. How are you able to confirm that was cause of death yet, or how long will that take?
My understanding in communicating with the provincial coroner is that he is now satisfied with the information that he's obtained from us and doesn't require an autopsy. So I think it would be, I'm not actually a pathologist. I wouldn't be able to make that definitive diagnosis. I would only be able to say that he did have COVID-19, and he did, after being in critical condition for a number of days, pass away.
Did he have existing respiratory conditions or other health conditions?
He had some pre-existing medical conditions, as did the other individual who died. And both of them also were in their 70s, which is another risk factor in and of itself.
Thank you.
Sorry, Kathy, can I ask just one quick question? I had a question about ventilators, but thank you, Janice, for answering that. Dr. Gardner, just wanted to confirm the three again that are on the Ontario government website from this morning, the 10:30 update. Male 40s, England, in hospital. Did you say this person is now home self-isolating or still in hospital?
So my information is that he's at home, isolated and recovering.
Okay. And do we know where these three?
I'm sorry, we might be confusing cases now, okay? Because we're now up to 9. Could you repeat the question? Because I believe I might have mixed that up with another case. Could you please state that again?
Yeah, just the three cases that were posted this morning to the Ontario government website: a male 50s who traveled to USA, male 20s, Ecuador, both indicating on the website self-isolating, and then a male 40s, England, and indicates hospitalization.
And so you were asking about the hospitalization man in England. That individual is in hospital at South Lake in serious condition.
And where is that person from? Go ahead.
Just having a look at the information here. I would like to get back to you with that information.
Okay. Is that the same male 20s, Ecuador, male 50s, USA?
No.
No, where they might be from?
So the individual who's in his 20s was actually a contact of an individual who traveled to Ecuador, and he lives in Bradford, West Gwillimbury. Mm-hmm. Now we got it. The male in his 40s traveled to the UK, hospitalized, is from Barrie.
Okay. And the male in his 50s from USA?
So that individual is recovering out of hospital in Collingwood.
Okay. Thank you.
You're welcome.
Follow-up questions?
I don't have a question,
Hey, Kathy,
but I would. Oh.
Sorry, this is James Boulder with URTV Muskoka. I haven't had a quick opportunity to ask a question yet. If I could just jump in.
Oh, sorry. Where are you from, James?
From URTV Muskoka.
Oh, yes. Thank you. I know we've emailed many times. Go ahead.
Yeah, no problem. It's for Dr. Gardner. I just wanted to confirm I've noticed that the health unit has now been posting probable cases. I just want to confirm what the term probable actually means from the health unit.
So we're following the province's definitions, case definitions. They do have a category called probable, which means individuals that have the appropriate symptomatology, respiratory symptomatology, who have had some kind of a contact that would put them at risk, whether it's traveled or have had direct contact with a diagnosed laboratory confirmed case, or direct contact with an individual with the symptoms who has traveled. And we've been receiving reports from physicians that have made these diagnoses. One of the key things about these diagnoses is that they don't have a laboratory test to confirm whether or not they actually have the infection, hence being called probable cases. So we've received reports from physicians, and we've followed up to get more information on those cases in quite a few instances. Upon follow-up with the cases, we found that they actually don't meet the case definition. So the number on our website has actually fluctuated because of that.
Thank you, Dr. Gardner.
You're welcome.
Kathy, it's Erica. I have one more question.
Okay.
What date did this man die in Barrie?
He died early this morning.
Okay, thank you.
Follow-up questions?
Just a quick comment, Kathy. Thank you so much for everything you guys are doing to keep everyone informed. I know it's a really busy time for you right now.
Well, thank you for that.
That is very much appreciated. Thank you.
And it's Janice Scott here.
Okay.
Could I just also add, of course, that we want to assure our community that RVH is prepared. We're trained for this. We're following all precautions to keep patients and the team safe. And really also want to thank Team RVH, particularly those on the front line, for continuing to provide exceptional care while also ensuring they're caring for themselves. Please, again, with the assessment center, if you're feeling you are having symptoms that you can't manage at home, then you should make your way to the assessment center where you will be seen by a health professional. They will determine whether or not you need to have the COVID-19 test or swab. However, if you do not experience symptoms, we'd ask you not to come to the assessment center.
Thank you. Any follow-up?
Yeah, I do. Erica? It's a question for Janice. Sorry, the 80 staff who you followed up with regarding contact, do they all have to self-isolate now?
No, each one will be handled individually because some may have had direct contact wearing their protective equipment. Others perhaps were earlier in the contact list, and so they would be self-isolating and following any symptoms. Others would be coming into work. So it's not, it isn't the whole group. Everyone is being individually contacted, and their individual experience will be assessed, and we're following all provincial directions with respect to the safety of our employees.
Okay, thank you. Further follow-up questions? Okay. Well, with that, perhaps we can conclude unless you have anything else that you would like to add, Dr. Gardner?
I always emphasize the importance of the social distancing message and for people to be very supportive and compliant with reducing risk to themselves and risk of transmission to others. I've spoken already to the importance of hand washing, of keeping a distance of 2 meters from people, of not going to crowds, to isolating yourselves if you develop symptoms, seeking medical attention if you develop worrisome severe symptomatology or if you're at high risk. This is the time for us all to comply with this, to flatten the curve and reduce the impact of the pandemic in our communities.
Okay, thank you. Janice, would you like to add any final words?
I think I've already mentioned, just really want to thank very much Team RVH, particularly those on the front line, and our leaders who are working around the clock to ensure that, first of all, our patients are treated appropriately, that our staff are safe, and really extraordinary efforts being made. So I just a heartfelt thanks to Team RVH.
Okay, thank you. Oh, all right. I think with that we will conclude. And I'm sure we will be talking to all of you in the coming days.